It's Wendy Bowen, physiotherapist with Know Your Body Better. So I wanted to talk with you about thoracic stabilization. So our thoracic spine is this middle part of our back. We focus a lot on stability in the lower back, a little bit in the neck, but we often avoid or miss doing stabilization exercises for our mid back. And what does stabilization do? Well, it keeps the muscles, help keep the joints in place when we're moving. So if you've ever had that feeling where you're reaching forward and all of a sudden your back locks up, well, it might be that it's over rotating. Sometimes that happens if we've had ligament damage underneath. Something over rotates, the muscles go and grab, and then you feel locked up. So we have to work the smaller muscles in the spine, the stabilizers, not just the ones that move us. So we'll put this guy aside. So there's a couple of really simple exercises that I've given clients in the past on stabilization. So one, you can just be sitting. You don't have to be sitting on the ball, but you can just take a weight, a small dumbbell, and you just do little mini rotations. You're not rotating far, just little ones. And if that's too much with the arms out there, you bring them in a little bit and just do little mini rotations this way. Now, if you have our lovely exercise band here, usually throw it through the doorway with a knot. Does this, and you get people standing, hanging on to the green band or red band, whichever one's easiest for you, and you just stand and little tiny rotations. I'm not moving very far. And of course, I'm tightening my belly button muscle here. You make it harder by the arms out. And you do both ways. And you don't want to do too many of these. I start with 5 to 10 reps. You build up to about 15 times. If you're having issues with these, talk with your physiotherapist, give you some ideas of how to modify that. You can make it a little bit harder if you want. And again, I would use some guidance with this, but I like to sit on the ball, roll out so your head's supported. You can take your dumbbell or your medicine ball, and you just do little rotations here. So here I'm just doing a figure 8. Okay, I can try to reach up overhead. And again, I'm just staying within a really small range. You can also just do a little bit of side to side movement. So we're looking at getting the smaller muscles to stabilize. And your body will tell you when you're going a little bit too far out of the range, so you just stop and pull back. So we want to work on stability of the whole spine, not just the lower back, mid back, and our neck. The last exercise actually targets all 3 body parts. So it's Wendy Bowen, physiotherapist with Know Your Body Better.